Hello, this is Dr. Cross, and I'll be talking about, in this video, Kerstashman and Hull's Values, Ethics, and the Resolution of Ethical Dilemmas, Chapter 11. In this chapter, you will examine and apply the National Association of Social Workers, NASW Code of Ethics, recognize the Canadian Association of Social Workers Code of Ethics, examine international ethical principles, identify ethical dilemmas, conceptualize and apply a decision-making strategy to address ethical dilemmas, rank ethical principles, and discuss and resolve ethical dilemmas in generalist practice context, demonstrate ethical communication on the internet, examine self-determination and people with disabilities and an empowerment approach, and appraise personal and professional values. The NASW Code of Ethics highlights 6 core values in the social work profession. Those core values are service, social justice, dignity and worth of the person, importance of human relationships, integrity, and competence. In the last video where I covered Chapter 1, I talked about what generalist social work practice and/or what social work services look like with keeping in mind the different roles that social workers play in generalist practice. Also talking about how that assessment, intervention, and planning as part of our services, core services to clients. Also talked a little bit about social welfare, social justice, economic justice that we covered in the first chapter. Also social justice as it relates to diversity, and limiting oppressive structures and barriers, avoiding of stereotypes. And I talked a little bit about cultural competence, but in this core value, we're talking about general practice competence. But we did talk a little bit about this in Chapter 1 of Kerstashman and Hull. But these are our 6 core values. As we're operating as social workers in generalist practice, we want to make sure that we apply and integrate these core values in our work with clients and within our agencies. Just as a reminder from the first video, I also talked about the importance of being aware and knowing what our core values are and distinguishing them from our own personal values, and making sure that when you're practicing, that you're making sure that your professional values are what you're applying to clients in the field. We also have ethical responsibilities and those ethical responsibilities include our commitment to clients, self-determination, as well as informed consent. Commitment to clients talks about the services that we provide, the contracts that we sign with clients to provide service and to practice at the top of our license and have the highest ethical standards in our practice with clients as part of that commitment. Self-determination, allowing clients to have the right to make their own decisions about their care and course of direction for their treatment. And informed consent, meaning to make sure that clients are well informed and they understand prior to consenting, whether it to an intervention, to treatment, that they are aware and they understand what it is that they are that they are consenting to. And we need to make sure that as social workers, we make sure that we do due diligence in making sure that we take the necessary steps to not only inform clients, educate them, but also make sure that they comprehend and understand prior to consenting to any treatment or engagement with social work. We have other type of ethical responsibilities. They include competence, again, making sure that we're practicing competently. We're utilizing skills in which we've been educated and trained to provide, making sure that we're competently within our scope of practice when we are working with our clients. We also need to make sure that we're culturally competent, particularly related to social diversity issues. And this is just making sure that we continue to engage in ongoing education related to cultural competence and doing everything in our power to understand clients from their cultural perspective. Also valuing the uniqueness and their the diversity components that they may bring to the table. That could be age, ethnicity. It can also be cultural. It could be spirituality. It could be sexual identity. It could be gender differences, immigration status, things that I talked about in our first video. We also have to make sure, as part of our ethical responsibilities, that we avoid conflicts of interest in terms of our work with clients, and at least if there are conflicts of interest, to be transparent about those conflicts of interest. Privacy and confidentiality is key in many of the assignments in this course and in other courses that you may take. You will oftentimes see that we ask as instructors that you de-identify clients, and this is to respect their privacy and confidentiality. Sometimes there are federal laws such as HIPAA that regulates privacy and confidentiality, but also within your agencies, they may have specific policies related to privacy and confidentiality, all meant to keep the clients protected and safe. Access to records is part of that, in that we must make sure that only clients have access to their records and that we keep them private and confidential. But also having a formal process in which to access records. Usually the standard of care is written consent from a client to release their records either to themselves or to another agency for continuity of care. But again, these are some of the ethical responsibilities that social workers have toward their clients. There are also more ethical responsibilities we have toward our clients. One is to not engage in sexual relationships, to be mindful and limit physical contact, especially inappropriate physical contact with clients. Avoid sexual harassment. These are ethical responsibilities, but also make sure you refer to your agency policies, because some agencies have specific and written language related to sexual harassment. Also, use of derogatory language is considered unethical in our obligations to clients. We also need to be mindful of other areas of ethical responsibilities, and that includes payment of services. And this is being very clear prior to services what the cost of services are, and also being mindful of clients' ability to pay for services, and making sure that from an ethical standpoint, we try to do all that we can to keep payments where clients can access services and care. We also need to be mindful of our ethical responsibilities toward clients who lack decision-making capacity. Oftentimes, this is governed by law, but also see who in that person's social circle, particularly family member, who have the capacity as well as the legal making ability to make legal decisions on behalf of that client, and making sure we have that documented. We have ethical obligations to inform clients when possible in advance of any interruption of services so that they are aware. But not only just to let them know about these interruptions of service, but if needed, transfer them to other areas of support and care during that time frame, so that clients can continue to have the services that they need. We also have an ethical obligation to have a formal process of termination of services. And standard of care is to make sure that termination is discussed at the beginning of the social work client relationship, and that client already from the beginning understands that there will be termination, and if possible, some type of estimated time of when that termination of services occur, or minimum what would need to happen for termination to occur in terms of goal fulfillment and so forth.